Are you tired of constant lower back and leg pain from that stubborn L4-L5 disc bulge? Relief is closer than you think. In this video, I'll walk you through the 5 simple and proven exercises to ease your lower back and leg pain and restore comfort to your daily life. If you've tried everything without success, these exercises might be the missing piece. They're specifically chosen to target your lower back and alleviate the pressure causing your leg pain. These exercises are simple, safe, and I'll walk you through each step in a clear and understandable way. They can be done at home, on the floor, without any equipment. I've taught these same exercises to hundreds of my patients with L4-L5 disc bulge, helping them find relief from lower back and leg pain, recover faster, and return to their normal daily activities. Stick with me until the end, because skipping any part of this video could be the reason why you continue to experience back and leg pain. And don't miss exercise 5. It's a fan favorite for a reason, offering relief like no other. Plus, I'll share a bonus 6th exercise that combines posture correction with soothing breathing techniques. You don't want to miss this one. Trust me, it's worth it. So let's get started and say goodbye to the nagging back and leg pain for good. Hi, I'm Dr. Ruminder Birk, a chiropractor in Woodbridge, Ontario, Canada. With over 24 years of clinical experience, we have helped thousands of patients recover from spinal conditions like disc bulge, disc herniation, disc degeneration, lumbar stenosis, sciatica, and radiculopathy, using our unique and proven Back to Life method. Now, before I dive in, I need you to hit that subscribe button if you want more tips on how to get relief at home from sciatica and disc-related pain and what therapies actually work for these conditions. Let's start with these exercises to ease your low back and leg pain. Follow the sequences I demonstrate in the video for best results. During the exercise demonstration, I'll tell you how many times to do each, how long to hold them, and how often to do them each day and week. So of course, the following back exercises should never be performed if they cause irritation to your back or any other condition while they're being performed. As each back condition is different, always consult your doctor before performing any of these exercises to determine what exercises, if any, are right for your particular condition. If you have any symptoms after performing any of these exercises, make sure to discontinue immediately and consult your doctor properly to assess the situation. So learning to stabilize the pelvis and finding a neutral spine position. The initial phase of stabilization training begins with isolated muscle contractions. Stabilization training is initiated when the patient is being instructed in the neutral spine position. The neutral spine position is where you find an ideal alignment and is found by envisioning the face of a clock on your abdomen. So 12 o'clock is at the belly button, 6 o'clock is at the bone right in the front of the pubic bone, and the pelvis is tilted alternatively between 12 and 6 o'clock, which rocks towards the ceiling. So go ahead and do that for us, Donna. So this stretch is very important, just to feel your pelvis engage. Repeat this 10 times in each direction, gently and slowly, so you're just rocking the pelvis back and forth to feel the muscles and the pelvis. So it's emphasized and should be maintained for basically 10 to 12 times back and forth. And then what we're going to do is find the position that's most comfortable here. So when you get to neutral, it's just going to feel between the 12 and 6 positions, so rock back to neutral and just about there. So Donna's feeling what it feels like to be in a neutral spine position. I want you to remember this position when you go out and do things around the house or the garden, or even when you're walking. This neutral position is going to create the most stability in your pelvis so you don't hurt your back doing things that you normally do around the house. The next one is going to be abdominal bracing. So it means to gently pull your abdominals straight back towards your spine, sucking in your belly button towards your spine. And as you do that, you're maintaining the spine in that neutral position we just discovered. You can tell if you're tensing the correct muscles by placing your fingers on the outside at the edge of the bones there where it should get tight and you feel those muscles contracting. While breathing, hold this for 10 seconds. So go ahead and do that, Donna. Just contract in the neutral position. Let's place those fingers and find that location with your hand there for me and feel those muscles getting rigid, right? So as you're confirming that it's getting tight and you're holding, deep breathing into that, and repeat that 10 times. That's great. So that's the steps that we take for abdominal bracing. So next is the hamstring stretch. So again, lying on your back, keeping your back flat, eyes focused towards the ceiling. Donna's going to go ahead and grab that thigh and bring the leg up at 90 degrees. slowly straighten the leg here to achieve the result of the hamstring stretch. So she's interlocked her fingers, she's able to straighten it out, but not completely. So I'm gonna have Donna release her hands, lower onto her leg, go back a bit, and now straighten from there where it's gonna be a little bit more manageable. To get a full leg extension means that it gets right into the hamstring. So she's gonna do this, obviously don't overdo it. Find the position that's best for you, or let go and bring it lower. If it feels good here and she's easy to do this, she's gonna bring that thigh up a little higher towards herself and get a deeper stretch into that hamstring. So again, this is very important to get all the loose muscles back to the spine. You can relax your leg there for me. So each leg we're gonna do for 30 seconds, both legs 30 seconds, and repeat them 3 times each. The cat-camel stretch is where we get down on all fours, and to create a hump of a camel position, she's rounding her back by pushing upward and rocking the pelvis backwards. And we hold that for a count of 1 and then go the opposite direction, arching the back just like a cat and extending the rear. So that brings the head up and brings the spine into the opposite direction. So you're gonna do this each way, back and forth, holding for 1 second count. And 1 repetition is by going down and back. And we're gonna do that for 10 times total. That's the cat-camel stretch. So the next is the piriformis and gluteus stretch. So lying down on your back again, bend your right knee and place your left leg over the right leg, resting the outside of on the ankle there. So that left leg is over the ankle, slightly up, pointing above the knee. And Donna's gonna reach through, grab with your left and on the inside and the right arm on the outside, interlocking those fingers again and pulling with a deep stretch towards the chest. That's gonna stretch the left glute in this case and provides a deep stretch of all of the pelvis and the hips. You're gonna hold this for a minimum of 30 seconds, performing each leg 3 times total, so we get the right and left glutes in a deep pelvis stretch. Remember to breathe, remember to relax into this posture, and don't overdo it. So a modification of the exact same stretch, the piriformis stretch, obviously if you have like difficulty getting on the floor, getting up off the floor, if there's severe knee pains and things like that, we can modify this into a seated chair position. Working at your desk, this is a great stretch you can do while you're at your office. So it's Donna sitting at the edge of the chair. You're gonna cross the left leg over that right knee again, similar position that we had on the floor, and she's gonna bend at the hips and waist to fill that deep stretch into the buttocks. So when you get into that feel-good range, not into the discomforts obviously, and push onto the inside of the knee on the left hand here, you can pressure that to give a little extra stretch. Same thing, we're gonna hold that for 30 seconds. Remember to breathe, relax into that. Nothing is forced here. We're trying to get a deep relaxation and stretch into the pelvis and groin to open up some of those tight muscles that we just don't think about when we're sitting for long periods. So as promised, here is your bonus exercise. Now this is a real relaxing one. It's called the Ruminder Relief position. Donna's sitting at the edge of the chair again. Rock the pelvis forward slightly and tuck your chin back in. So you're gonna turn your hands out so your thumbs are pointing behind you. And Donna's bringing her head back into a nice relaxed position, but also now taking a deep breath in, hold for 2 seconds, breathing back out, let it all the way out and relax. And we repeat this 10 times. So you're gonna perform this one several times a day, obviously. Anytime you're at a red light, at the office, sitting at home watching TV, there's so many opportunities to really reposition yourself, recheck in with your posture, take some deep breaths, de-stress yourself, and this is really relaxing for the entire spine, but reinforcing your posture at the same time. You now have a set of exercises you can do at home to relieve lower back and leg pain caused by L4-L5 or L5-S1 disc bulge. If you have any questions about these exercises, ask me in the comments below. Now I want to hear from you. Which exercises gave you the most relief? Was it the cat-camel exercise or the piriformis stretch? Let me know in the comment section. If you found value in the video, be sure to like and share it now. And go ahead and subscribe to my channel now if you want more tips on how to relieve sciatica and disc-related pain and what treatments actually work for L4-L5 disc bulge. Now the next video you should watch next is this one over here. L4-L5 Disc Bulge Explained from Pain to Permanent Relief. Go watch this video now.